Welcome, and thank you for joining the second day of the National Maternal Health PCOR Network's virtual symposium. My name is NeKeshia Jones, and I serve as the project lead of this initiative, which is housed at Health Resources in Action, a public health nonprofit based in Boston, Massachusetts, and is funded by the Patient-Centered Outcomes Research Institute. The 2020 symposium will bring together diverse stakeholders to frame how structural or institutional inequities, including racism in research, affect maternal outcomes, discuss how grassroots advocacy can facilitate policy changes to improve maternal care, provide input into this initiative's developing patient-centered outcomes research agenda, and highlight the work of others who are working to improve birth outcomes. The network exists to collaborate across many sectors to respond to inequities in maternal care. We are comprised of members who represent individuals with lived experience, researchers, and others such as maternal health advocates and birth workers. I want to take a moment to acknowledge our members, contributors, and HRiA staff who have worked together to bring you our three-day symposium. I also like to acknowledge the symposium planning working group members who worked in partnership for several months to shape the symposium's agenda. Those members include Heather Oden, Katie Barrett, Marie McCausland, Mary Bentley Lamar, and Nneka Hall. We've structured our program today in 4 parts. We began with a pre-symposium wellness activity that was led by Dr. Reed so that we could prepare ourselves to participate in our program today. The second part of our program will feature a conversation with collaborators, Timoria Saba, Nneka Hall, and Dr. Ndidiamaka Amutah-Onukagha, to discuss their work together in partnering for advocacy. After the discussion, we'll transition to breakout session presentations. We will post the information for you to access the links to these breakout session presentations in the chat at the end of the panel discussion. We have 3 presentations for you to choose from today. One presentation will highlight the work of an academic community partnership of their Celebrate Day 366 event, which aims to increase awareness of infant mortality and the importance of fatherhood and co-parenting. Another presentation will provide a roadmap of how to meaningfully integrate community voice into action to implement and support innovative citywide interventions that specifically address contributors to maternal mortality. And the third presentation, presenters will share their initiative's collaborative agenda and facilitate a conversation about the most promising and feasible policy, practice, and payment changes needed to enact the agenda and eliminate racism and fragmentation in the care of pregnant and parenting people. Lastly, we will end our program today with a mindfulness exercise led by Nneka Hall to help us transition from the program. Although we're providing space for centering and acceptance, we ask that you be mindful of your own well-being during our time together. So please stand, stretch, move around, and take a break as needed. So help us keep this experience as a safe space for everyone involved. Please feel free to enter your comments in the chat box or use the question panel to submit questions. You may also address your comments or questions to specific presenters. We're monitoring comments and questions, and will help to facilitate responses based on the time we have in our program today. While interacting with other attendees and symposium presenters, please be respectful of others and their ideas, address issues, be solution-oriented, and maintain confidentiality. We also ask that you add to the discussion on social media by using the following hashtags: birth equity, PCOR, and NMHPN. Now, for the second part of our program today, we are holding a discussion with colleagues who have been working together to advance equity in maternal health. I am joined by my colleague Lauren Ansong dePass, who will help moderate our discussion. It is my pleasure to introduce our panelists. Nneka Hall is a pregnancy and infant loss awareness advocate, founder of the Quietly United and Lost Together quilt campaign. Ms. Hall focuses primarily on the diversity of experiences in infant and maternal mortality in the African American community. We also have joining us for our panel discussion today, Timoria McQueen Saba. She is a maternal health writer, advocate, and speaker specializing in mental and physical trauma due to childbirth and pregnancy. After her own near-death birthing experience, Ms. Saba recognized the need for birthing people to have their birth experiences validated. Ms. Saba has written for several websites, including the Huffington Post, and is often a featured guest speaker for hospital support groups, as well as information sessions for doctors, midwives, and therapists. And lastly, part of our panel discussion today, we have Dr. Ndidiamaka Amutah-Onukagha. Dr. Amutah-Onukagha received her PhD in public health with a focus on maternal and child health at the University of Maryland, College Park School of Public Health in 2010. Since 2018, Dr. Amutah-Onukagha has planned and led a national conference on Black maternal health inequities, reaching healthcare providers, community health workers, doulas, students, and community activists. She is also the principal investigator of an R1-funded initiative by NIH aimed at examining maternal safety bundles and the role of doulas in maternal health outcomes for Black women. Dr. Amutah-Onukagha also serves as the principal investigator of an RWJF-funded community-based participatory study on Black maternal health and the role of partners, providers, and families. So thank you all for joining us for our panel discussion today. I'm going to ask that you turn on your cameras so that our audience can see your lovely faces. And I'm going to turn it over to my colleague, Lauren, to ask the first question.
Great, thank you, NeKeshia, and thank you again to all of our panelists. I'm really excited to hear from you and to learn from your experiences in the collaborative work that you've been doing. So to begin, just to give us background and help folks hear more about your own stories, we'd love to hear about your experience and your background. So how did you all get involved in advocating to improve maternal health outcomes, and what has been your journey? And Timoria, could you begin?
Hi, everybody. I'm really happy to be here. Thank you. This is a wonderful event. So improving maternal health outcomes is very personal to me. I am a person who survived a postpartum hemorrhage, a miscarriage, and being diagnosed with PTSD because of those things. In 2010, I suffered a miscarriage I had a postpartum hemorrhage after the birth of my oldest daughter. 13 months later, I had a miscarriage while getting a frozen yogurt in a yogurt shop, and later had to have an emergency D&C. And due to these events, I was diagnosed with PTSD and had to recover from those things. As I was beginning to look for resources for myself as a new mother, I realized that resources for women like me who specifically had suffered a birth trauma and pregnancy complication were very scarce. They really didn't exist back then. And so I found myself digging for resources and connections and support. And most of the support was geared towards women who were suffering from postpartum depression or anxiety. There was really no one talking about women who died during childbirth or people like me who survived birth trauma and pregnancy complications. And so that was the beginning of my journey.
Wonderful, thank you for sharing. And Nneka, could you share next, please? Nneka, I think you're on mute.
Sorry about that. Thank you for having me. Similarly to Timoria's intro, motherhood brought me to this journey. I'm a mom of 4, and as everyone knows, becoming a mother, the birthing experience varies from birth to birth, and motherhood has shown me that, or giving birth has shown me that you can have an uneventful pregnancy that runs the 40-week period rapidly and have a child on their due date. You can have an seemingly uneventful pregnancy, have a child the day before their due date, take them home, and then find out that they're chronically ill. They can have surgery, and then they can live a perfectly normal life. With my 3rd, my daughter was stillborn at 39 weeks. She was perfectly happy, healthy, but yet they missed preeclampsia. So had no idea that that was going on with me, and that stole her life. And the 4th pregnancy, I always say, was the best one, simply because I felt like I was fully in control of it. My rainbow pregnancy, my daughter's birth was amazing, even having the doctor, and I negotiate everything every step of the way. And to have the doctor come in to deliver her herself, to catch her herself. These experiences, mainly the stillbirth and saying, wait a minute, this should never have happened. And then finding out after losing my daughter, the statistics that Black women face pertaining to their reproductive health across the board, be it gynecological issues, as well as giving birth, and hearing the falsehood that, there are no Black men because, they're all in jail, and finding out that there are no Black men because they died before their first birthday. That hit me. So I became a doula and needed to learn more and more and more and more and more. And then I just kept going. So that's what's brought me here today. It's not where I expected to be at 47. I never planned to have my last baby at 41, excuse me. I felt that was too old, but it was the best pregnancy, and it was a good thing I had her at 40, because that I probably would have still had one every year after that. But that's how all of my pregnancies should have been. And that's how every birthing person in the United States deserves to be. They deserve to have that beautiful experience, regardless of the outcome.
Wow, yes, thank you for sharing as well. Both you and Timoria really shared really very powerful personal stories. And so Dr. Amutah-Onukagha, we're also really excited to hear from you as well. What was your journey to this space?
Good evening, everyone. I'm honored to be presenting with my colleagues and friends, Timoria and Nneka. Thank you to NeKeshia for having me. Thank you to Lauren for moderating. So as I was reflecting on my friends' stories here, I was thinking about my own journey, and I consider myself to be one of those people that kind of falls into things because I'm so curious. And so I remember, so just by way of context, I'm Nigerian American, but I grew up in New Jersey, so I'm a Nigerian Jersey girl. Okay. And I remember at a very young age of 15, I actually lost a friend to maternal complications. And the city I grew up in, Trenton, New Jersey, is now considered a maternity desert. We have no major birthing hospitals in our local area. And, at the time, I didn't really understand disparities. I didn't understand inequities. I just knew that my friend had died. She had a baby at 15. Her daughter just graduated from college a little while ago. She's going to law school. And she died from complications around lupus. And so for me, that was really what sparked. I mean, even as a young kid growing up in the hood, I'm like, people aren't supposed to be dying at 15. Like, that's not normal. And just to know that 20 minutes away in wealthier counterparts and wealthier communities, right? Like the resources, the hospital system. So I became a disparities researcher just by way of lived experience. And then fast forward, graduated from high school, went to college, got my PhD. During my postdoc, which was in Baltimore, I was funded by the Kellogg Foundation to do community-based participatory research. So who was working with me in the cubicle next to me was Dr. Shalon Irving, who was, if anybody has followed this work on maternal mortality morbidity, we know that she was a CDC researcher, tremendous expertise, high education, and she died 3 weeks postpartum from complications. So, and I'll never forget the day I got that call, right? Shalon had always wanted to be a mother. And even in our postdoc, this was 2009 through 11, she was excited about the prospect of motherhood. She finally achieved her goal. And due to so many lapses, injustices, dismissiveness, the racism of the healthcare system, her death could totally been preventable. So we have a childhood situation. I was 15. I see the system has failed Black women. We have an adult situation in my professional life. The system again has failed Black women. And I'm also a new mother myself, right? I have an 18-month-old toddler. And, you know, regardless of education, background, circumstances, resources, or lack thereof, we know that the system is broken, particularly for Black women and Black birthing people. So this is my life's work. This is my journey, my calling, and I feel it's my duty to use my privilege, my power, my voice, my passion to move this work forward, both in the community and the research world. You know, in my introduction, NeKeshia mentioned that I'm a principal investigator of an R1 funded study. For those of us in academia, that's the largest grant you can get. There's less than 1% of that funding that goes to Black investigators. So I joined the Unicorn Club. When I got the grant, people called me and said, you're now a unicorn. You know that, like you represent maybe 5 Black women across the country that have this level of funding and are doing work in this area. And so it's my obligation, it's my privilege and my power and my honor really to move this work forward and to be unapologetic about representing the best interests of Black women in the spaces that I'm privileged to be in.
Wow, thank you. Thank you, Timoria, Nneka, and Dr. Amutah-Onukagha for sharing your experiences as well as your journey, what led you to this space. So Nneka, we're going to start with you for the next question. And I want to know from all of your perspectives, how did you 3 start working together? Like, what is your collaboration story?
Well, I met Dr. Ndidi when I was working on a March for Moms event here in Massachusetts. And this is before she became a mom, you know, and someone referred her, and I was working with HRiA dos Santos, who's actually listening in. And I don't know which one of us, I think she reached out to her, but I was just so excited when she showed up because she showed up with energy. You know, we still have the video, if anyone wants to see it, of that day. Showed up with a lot of energy, spoke powerfully, and just, you know, after meeting her, somehow we just seemed to be showing up in the same meetings, in the same work groups, just wherever. And then her name was always there on the tip of someone's tongue. I had heard about Timoria because I always refer to Timoria as the other half of my coin. We have 2 halves of the same, you know, being that she is a survivor of the whole maternal mortality demographic, and I'm a survivor of the infant mortality, which are both 2 sides of the same coin. But until 2019, we had never worked together. I remember seeing her on different email chains and saying, wow, I wonder who she is. Excited to get to know her. And then one day I showed up at, goodness, where was it? I showed up at the, no, that was before that. I showed up at the, I think it was the Mass Medical Society before the commission thingy, commission, PPD day, or after, I can't remember, but either way, we connected over both of those events. And I just grabbed onto her and never let go. I mean, it's just an amazing, she's like the sister I always wanted, the cool sister. You know, her children are like sort of younger than mine, but not really in maturity. And she's just a phenomenal advocate. And I just love the way that people inhale when she walks into a room. I'm like, okay, I need to learn everything from T. But if anything happens within any of our communities, I know two people that have my back. If anybody says anything derogatory about me on a tweet, I know who has my back. And if I'm just looking silly or acting crazy, I know who's going to tell me the truth. And in doing this work, that's what you need. You need allies and friends and sisters and people who know where you come from and are ready to do the work, get down in the muck of it and take on any battle. And these two will. We're a force, you know, and there are a few more people that we have in our little network who are, you know, if we could have done this whole thing. I mean, if we had added in all of our people and just had like the best conversation in the world, maybe next year. But they're just phenomenal. Absolutely phenomenal.
Oh, thank you, Nneka. And I think there are a few attendees who agree with your words that, you know, you are to be reckoned with. Timoria, I'm going to ask you next, like share from your perspective what the journey has been for you three teaming up and collaborating together.
Thank you. Gosh, how do I follow all that, Nneka? You know, interesting because you all know I love receipts. So I actually went digging for how we first met. I was like searching through my emails a couple of days ago, like I couldn't really place it. I knew, you know, I think sometimes the better question for me sometimes is, how did I not meet you sooner? Because it feels like I've always known you both. You're both two smart, passionate, powerful women, not only in the space of maternal health, but also in your personal lives. You know, it takes a lot to do this work and to also maintain your household, be committed to your families, and still continue to give to the communities who need us. So, you know, this for me, and I'm an only child, you know, this for me has been just an amazing sisterhood. I too have found sisters that I never knew I wanted, you know, that's how I put it, but I'm glad to have them. And they do know, you know, absolutely. I feel that they have my back. They know that I have their back. Nneka, I had heard of because she was so unique in a certain space, this space of bereavement and infant loss. And that was completely new to me. And, you know, we'll get into that a little bit later. And Didi and I met through a mutual friend who's a brilliant doctor named Dr. Audra Meadows. And so it was one of these things where Dr. Meadows texted me and said, hey, do you know Dr. Ndidi? You know, and I went, no. And she's like, how do you not know her? You know, because everyone thinks I know everybody. I said, I don't know her. And she said, okay, well, you're going to be speaking at her event. I'm going to set it all up. And, you know, and so Dr. Ndidi does an amazing event every year at Tufts for Black Maternal Health Week. It's phenomenal. It's jam-packed, great speakers, just a wonderful event. And so we connected through the process of me being one of her presenters last year. And I think when we met, we just locked eyes and that was it. I think we, you know, it was, again, you just feeling this work. I think some of us sometimes feel that the work can be isolating and a little lonely. And then we do realize how connected we are when we get in front of each other and we're speaking to each other. We definitely feel just a wonderful sisterhood and just have a great working and personal relationship with each other.
Oh, thank you, Timoria, for sharing your. Dr. Amutah-Onukagha, please share from your perspective what the collaboration journey has been like.
Well, first of all, and Timoria, I appreciate you having receipts. I love that. So, you know, I've only been in Boston 3 years, y'all. Like I literally just got here September 1st, 2017. And so it feels like it's been a lifetime. And, I think when you do this work authentically, when people feel your spirit, your connection, your commitment to the work, they put you in the spaces you need to be in, right? So I met Nneka pretty early on with March for Moms, and I knew she was a force. And you talking about people taking a breath when Timoria come in the room, no, they take a breath when you come in the room, both of y'all. Okay? That's two breaths, okay? So so I was impressed with the work of her and HRiA for putting that on. And again, like I told you guys, I'm Massachusetts is growing on me. The longer I stay here and the deeper my relationships get, right? Because I'm like a Jersey girl and blah, blah, blah. Then Boston doesn't have a really great reputation for Black people. So when I was moving here, I had a going away party. I'm very extra. I like big parties. I mean, post-COVID, we'll talk about that. But, people are like, you going to Boston? Are you sure Boston's ready for you? They call me Asata in my circle. They're like, Asata, you going to Boston? And I said, well, let's see what Boston's going to give. And, I met Nneka, tremendous force. HRiA also force. Dr. Meadows, like Timoria said. And, the purpose of the conference last year was on Black maternal health. And there was nobody else that I could think of besides Timoria. Her story is so compelling and she has done so much work. So I just really, I respect both of these women. Like both of them have said, it's a sisterhood. There's a shared understanding. So when you're with your people, you don't have to do a lot, right? You don't have to, there's a shared understanding and mutual respect for the expertise that all of us bring to the space. And I just look forward to continuing alongside this trio. I think we got a lot of work to do, and I'm just honored to be here and just really appreciative of being received so well as a newcomer to the Boston area.
Well, thank you all so much for sharing. I think as someone who's younger in their career, it's really powerful for me to see 3 dynamic Black women working together so powerfully and building a sisterhood that's literally affecting generations of people. So I just want to make space to honor and celebrate the relationship that you all build and the work that you're doing, because it's a really beautiful model for us to see. And I think with that, how can your collaboration story be a model for other folks from different disciplines to work together as well? I think what makes you all so unique is that you all have your sphere of influence and expertise, and together you are this really dynamic trio. And so how can other folks do that as well? And Dr. Amutah-Onukagha, if you could start, that'd be great.
Sure. I mean, I say this all the time as an academician. I'm in the academy. I'm not of the academy, right? Like, yes, I have a PhD. Yes, I'm a researcher. Yes, I'm a professor. But I'm very clear about my purpose and my positioning in the academy. One is to train the next cadre of maternal health advocates, scholars, researchers. I run a lab called the Mother Lab, which stands for Maternal Outcomes for Translational Health Equity Research. I have 28 students, majority Black and brown. That's my positioning in that space, right? And so one, training students and being a resource and a mentor for students in the greater Boston area who are looking for that support, who probably have never had a Black professor who knows that they're Black, you know what I mean? Who still connects with the Black community and the Black experience, that is not so egotistical or unapproachable that they can't get next to me. And so I consider myself to be a scholar activist. I am here to take the resources of the academy and the privilege of the academy and put it in the places of community. That's where it belongs. It doesn't belong in New England Journal of Medicine. It doesn't belong on a poster presentation. It belongs in the community. And so, we have to do this delicate balance of, publishing and presenting and all the things to gain traction and move from assistant to associate to full, dean, provost, whatever the trajectory looks like. But that's why I always come back to it and said, I just happen to be a mold that just happened to be placed in the academy, right? Like I'm just here to take what the academy got and put it in the community. And I'm unapologetic about that because, I'm one of 2 Black faculty in the School of Medicine, right? Like I told you guys, the R1 study, there's less than 1% of funding, y'all, that goes to researchers of color at the R1 level. And so I understand really clearly that to do this work, you have to connect with the gatekeepers, the experts in the community. Nneka is a force. Timoria is a force. Nobody should be doing anything on Black maternal health without including these 2 women. I don't care if it's policy. I don't care if it's funding, resources, opportunities. Like you have to pay homage and pay respect to the women whose lived experiences are helping to shape policy. State and national policy, state and federal policy, to prioritize funding, to put some credence and visibility behind this. You have to pay homage to the people that have lived that experience, have walked that walk, and credentials or not credentials, they're the experts. And so I come from a space of humility, of understanding, of mutual respect and admiration, and also someone that's a strategist person and said, okay, what do we have here that I can put in the hands of these women and they're gonna make it pop? And so that's really, you know, the benefit of having that interdisciplinary collaborative approach.
Ooh, my apologies. I was so processing. I forgot my job.
Sorry, I didn't give you a heads up either.
No, I really appreciate it. I was like, oh, wow, that's so powerful. Okay, back to my job. Nneka, could you please also share how can folks really use y'all's relationship as a model for collaborative work? So how can other folks, interdisciplinarians, think about collaboration in the way that you all do?
Well, Ndidi said everything, but I will add in, be mindful of who you decide to partner with. It's imperative to connect with like-minded people, not just powerful people. Weed out those who are not true allies and cut them off. Because remember that whole guilt by association thing, that's a real thing. And you will not get past the gatekeepers based on some of the folks that you might perceive as powerful and who you want to allow into your surroundings. Choose to work with people who are transparent and fully present. You can't work with someone if they have hidden agendas. That brings the whole project down, and it really says that your work is not valid. You know, and if you're working in an organization or a group of people who says that they're about equity and no one in that organization looks like us, I'm gonna just leave that there.
Well, you know, yeah, that's really powerful. I think that's really powerful. I think thinking about who you're collaborating with is just as important as the collaboration itself. And then Timoria, could you bring us home? I guess, how can other folks really use y'all's collaboration story as a model?
So in terms of thinking of it as a model, really think about the 3 different perspectives. And for me, this is all about how so many different people enter into the maternal health space, or just healthcare in general, into the space. And they come from so many different perspectives, and each person is an expert in their lived and professional experience. And so really it's a respect issue. So, you know, just again, getting back to some of the earlier points, it's not really looking at a credential and saying this person is the expert. It's the totality of the whole person, regardless of how they entered this work, right? So for me, you know, people come to me with all sorts of issues that they have, and I try to connect them to resources and support. But what I pinpoint in terms of being an expert, I think to myself, if I have someone with infant loss, that's not really my area, and I need to go to the expert who I know, and that's Nneka. Nneka has taught me so much about not just infant loss, but how important it is to allow families to go through the grieving process. And even thinking about my own miscarriage, I don't think Nneka even realized how much, it's been years since that happened, but she's helped me sort of process it so much, because when it happened to me, so much of the conversation from family and friends was that, you know, oh, you know, this happens to people, get over it, at least you already have one healthy baby. We also scientifically understand that it's a chromosomal issue sometimes. So but for me, it was a loss that I needed to process. And so, you know, I've learned so much about Nneka in terms of that, and also what doulas do. And when I think about Dr. Ndidi, and this goes for all of us, I don't think any one of us entered into the work wanting to be social justice warriors. You know, I was just looking to connect to other people who had some bad stuff go down, you know, during birth and pregnancy, and just, you know, let's all get a group together and just hold each other, right? And of course, it evolved into so much more. But, you know, so what happens is, because of, you know, connecting to other people, you do realize that there is a need to be a voice. But in order to be a voice and to get the work done in the right way, you have to not just collaborate. And I always say this, collaboration is not integration. You have to integrate all of the voices into the conversation. We think that, you know, we see people doing things and it's a little cute workshop here and there or whatever, but really how integrated are these ideals of racial equity in healthcare into individual organizations? And the truth is that they're absolutely not. And that's what we are working so hard to be able to do.
Thank you, Timoria, Nneka, and Dr. Amutah-Onukagha for sharing your perspectives. I think in your responses, you're really giving a lot of us who wish to be in this space of advocacy, giving us a window into sort of what it really takes, and just sort of really staying true to your own convictions around sort of what and who you choose to work for and with. My next question, and I think some of you have already touched on this, but how can individuals be strategic in working together in interdisciplinary approaches to achieve action-related work? For example, I think just looking at you three, where you have a researcher, maternal health advocate, and a birth worker, using that as an example, how can researchers work collaboratively with patient advocates and birth workers as an example? But please feel free to share. And we'll start with you, Timoria, for the next question.
Oh yeah, because you know I got a mouthful on this, so you direct this towards me. You know, so the most important part of your question is actually working together. And that seems to be one of the hardest things for people to be able to do, because it's not just working together, it's working together with the right voices while these decisions are being made, right? So, and deciding not to work in silos or act as gatekeepers to information and opportunities. And we've all experienced that happening to us. So for example, when I'm asked to participate in an initiative, even, you know, like this, NeKeshia, you and I've had several conversations, right? And I say, well, who else do you have? Are you sure you even want me to do it? Let's find somebody else, you know, like, I'm not getting too old for all this stuff, you know, like, you know, because I'm always thinking, you know, there's other voices that need to be brought in. And I'm not just thinking about my own on a patient advocate level, right? Or even on a legislative level or whatever. What I'm thinking is, I'm not seeing enough doulas at the table. I'm not seeing enough midwives at the table. I don't see mental health providers at the table. I don't see nurses. I don't see pediatricians, right? So when we think about maternal health, you know, we're so focused on OBGYN, right? And then we think in terms of policy, but we're not really covering all the ground. And so getting back to something Nneka said earlier, because it's so, so important. If you're in a meeting about Black maternal health and disparities in outcomes and racism in healthcare, and you're in a room with mostly white people or all white people, ask yourself why. I mean, really, why are these people in this room trying to solve this problem, which doesn't affect them? Why are Black providers and advocates and even legislators, right? But a lot of, you know, Black advocates and providers, why aren't we being given the opportunities to really lead this work, which affects our people? And by leading it, what I mean is, what is so bad about walking into a room and it's all Black people figuring out a problem that affects Black healthcare? These rooms should look the reverse of what they all look like. You know, we've all been in these rooms where we've been the only, you know, or maybe even there's two and you're like, oh, wow, there's another one, great, right? But that's not enough. We need to flip what these rooms look like. If we're talking about Black healthcare, these rooms should be filled with majority Black people from all the different perspectives that I mentioned earlier, so that we can really begin to solve a problem. We cannot depend on people who the problem doesn't affect to solve an issue for the others. It makes no sense to me. So I'm going to stop there because you only gave me 3 minutes.
Thank you. That was a lot to take in, and just to even continuously process your words. I just want to say thank you for being really authentic and sharing what your perspective is and what your thoughts are. So thank you. So I'm going to ask you, Dr. Amutah-Onukagha to also share what your thoughts are about how individuals can work strategically together to achieve action-related work.
Well, first of all, I think researchers, like, we have to like get out the scene. And when I say get out the scene, like, there's so much ego and so much bravado in the academy, like it's a bit much, right? Because it really becomes a barrier to the work. And we're so full of ourselves and our degrees and our endowed titles and how much research money we get. We sometimes forget that there is no research without the community, first of all. And second of all, you can't build relationships in a descriptive statistic. Right? This is not a survey that you're going to churn out a table and be able to just publish the results. You have to do the work. There's no shortcut to doing the work. It's either like, I love my pancakes. Anybody that knows me knows the weekends are for pancakes. I make different types of pancakes on the weekend. It's either like some weekends, right? Like I want to make my pancakes I'm sifting the flour, the butter, blah, blah, blah. And then sometimes I'm like, okay, let me get it out the box. See, research, so which one tastes better? The one that tasted with the sift, right? The one you take your time, you get the cold butter, you get your cinnamon and all that. That's how research is. There's no shortcut to it. There's no shortcut. And I think a lot of time researchers fall flat because they spend so much time trying to cajole the community, trying to push the community. No. See, the thing where people mess up is you got to do the work. People need to see your face in the place. You don't send your team, you go yourself. You don't jump on the phone, you go in person. You build authentic relationships that are mutually beneficial based on trust. That's how you do this type of work. There's no shortcut to it. The whole first year I was in Boston, I told you guys I moved here September 1st, 2017, in the Uber from Logan, okay? My husband can attest to this. In the Uber from Logan to where we live now in Dorchester, my Uber driver was a Black one. I'm like, hey sis, where you get your hair done? I just landed. I didn't even get to my new house yet. I'm trying to build a relationship in the Uber, okay? Because I understand when you come into a new space, you got to get a lay of the land. Where do we get our hair done over here? Where can I go get some good jerk chicken? Where can I go get a good word from God? Like, that's what I'm trying to do. There's no shortcut to that, right? You can look on Google, you can look on Yelp, you can use your large survey databases if you want to. But if you really want to move this particular work forward, you got to get in there and do it yourself authentically. Leave the egos at the door, leave the degrees at the door, and just show up as yourself. The good, the bad, the ugly, right? That's what people are looking for, that authenticity. Communities of color have been so over-researched. There is such a deep and profound and understandable mistrust of healthcare providers, healthcare systems, researchers. You're already coming from behind the 8 ball. So if you want to do the work the right way, show up as yourself, spend the time. The whole first year, nobody even knew who I was. Nobody knew who I was, so I did a conference. That was April 2018. So from September till April, I'm just being the pavement. I'm at the Demic Center. I'm over here trying to see, I'm talking to Audra. I'm talking to Nneka. Like, I'm just in the background, like, who are the players here? Who do I need to get next to? Who I got to go to coffee with? I'm meeting with NeKeshia Burrell. Shout out to NeKeshia. She and I having coffee at Flat Black on Dorchester Avenue. I'm doing the work. I'm trying to get in, right? And just because I'm Black does not mean that I'm in, right? People got to see your spirit. People got to connect with you. So for me as a researcher, I say it all the time. If you're going to do the work, do it in the spirit of community. When I have this Black Maternal Health Conference that Timoria alluded to, be good. You can drop your kids off. Okay, we got lactation. This year, what we would have had if it wasn't for COVID, we had a mama Zen room. Come and get your Zen on, right? Just debrief, like, I'm meeting the needs of the community. It's a full day conference, y'all, free. Breakfast, lunch, snacks, breakouts, free. That's how you do the work. You don't cut corners with it. And if you cut corners, the community's gonna check you and you're gonna be exited stage left. So that's how you do the work.
Thank you. Thank you so much, Dr. Amutah-Onukagha, for just sharing from your perspective as a researcher for how researchers should work in the community and how they should be respectful of relationships, and also too just others who have been doing work for a very long time. So I really appreciate you just sharing sort of what your journey has been and how you established ties in the Boston area. Nneka, so we're going to ask you same question. What do you think individuals can do in working together to achieve action-related work?
unmute. I always forget to unmute myself on these things. My sisters have said everything, but one thing that I can add it to the whole going into the community. I was born in DC, but raised in Boston. So I've been here pretty much the majority of my life. But being raised in Boston does not mean that I know Boston. So I have had to pound the pavement myself. And I remember, and I'm taking myself back there, so that'll date me. Freedom Summer 95 was the first time I had ever gone with, those of you who are from Boston are familiar with Reverend Rivers and what a force he is in the Dorchester community, Codman Square area, from Codman Square to Four Corners. And I can remember being a teenager, walking the streets of Dorchester, pounding on door knocking. And that instilled a lot of who I am today by just doing that for one summer. Now I'm sort of fearless in approaching people. And last month, actually, September seems so far away. It seems like it was months ago, but last month I launched a project called Mama's Kitchen out of the Black church because I could not figure out what else it would take to save our women and babies. What else would it take to rid our communities of postpartum depression and anxiety and PTSD? So I took it back to the church because I remember growing up on a Saturday, everybody would be at the church, whether you belonged at the church or not. You know, most of the people I remember doing things on Saturday have passed on. But this was a way to tell the community we are here and we're sincere. Now, to piggyback off of what my sisters have said, in order to seem sincere, in order to truly be sincere, don't talk about going into the communities without physically going into these communities. Meet with the folks. Take it to church if you have to. We all know that every person who's running for office has been through certain churches in the United States. All roads lead to Charles Street here in Massachusetts when you are planning to run for office. So take it to church. You don't have to go every Sunday. I don't go to church. But I take, whenever there's a problem going on in the community, that's where I go and say, look, this is a problem. How can we collectively solve it? This is what our researchers should be doing. This is the only way to sincerely reach the demographics that they are researching. And only way to appear sincere, to actually be seen in those communities, especially if they are not of those communities.
So thank you all. I really, really appreciate you all sharing about the power and the significance and importance of authenticity, of taking the time to build relationships that are meaningful, and the work and being willing to actually do the work and not cut corners, like you all mentioned. And so with that, I think you all alluded to this a bit as well. What are challenges of interdisciplinary approaches, this collaborative work that we've been talking about, and what are ways or strategies that folks can use to overcome those challenges? And Timoria, if you could begin, that would be great.
Thank you. So to me, there's two main things, and I'll start with the first. So on one end, there's a fear of people saying what needs to be said when the time comes to say these things. And during that same time, what's happening is that people listening to the reality of what's occurring in the Black maternal health crisis, they put the walls up because they get uncomfortable, they get offended, they don't want to really, they know it because they've seen the statistics, right? They've read the data. But when a real live person who's lived it, like myself or Nneka, is standing there, sometimes it's hard for them to process it and also process the effects that racism has had on a patient and their lived experience in the healthcare system. And the most important thing for the people to remember is, because I walk into a room and I'm not thinking about making people comfortable. I'm thinking about making change. I'm thinking about saving lives. I'm thinking about how grateful I am to actually be able to walk into the room after having almost died 2 times because of childbirth and pregnancy complications. So it is my absolute duty, it's my responsibility to Black women who didn't survive, and also to the survivors who maybe they don't have a platform. They're barely hanging on, some of them still. They're waiting for, some change. It is my absolute responsibility in this role as a patient advocate to always keep patients centered in the conversation. I'm there for the patient, and I'm not there to appease the healthcare providers. I'm there to tell the truth about what's happening with patients in the healthcare system in America. So that's the first thing. And the challenge is really getting people to just open up, take the walls down, listen, receive, and then take action. The challenge is in the action piece, because if everyone loves having a meeting about it, everyone loves having someone come and tell a story about it, but the challenge is getting them to actually take an action. The second challenge I found is actually in literacy. So we have health literacy and we have legislative literacy, right? And so, these are 2 different types of languages. And so even for me, when I started in my advocacy work, I didn't know all these clinical terms, and now I'm so fancy throwing words, uterine atony and all this other stuff I'm able to whip out like it's nothing. But I had to, I remember days of like Googling stuff after a meeting, like, oh Lord, I got to learn this stuff. And of course, now I have political literacy. I understand all these legislative terms because, we've collaborated, the 3 of us, on helping to write many pieces of legislation. That's one of the things I'm most proud of with my super trio here, is that we've done a lot of that. And so for me, a major part of my advocacy is making sure that the barriers between patients, clinicians, and legislators, that we take those barriers down. We need to break these down so these groups are not only listening to each other, but they actually hear and understand. They take in what each person's experience has been and what their needs are. And so once we sort of get to that level where we're really able to understand each other in that way, that to me is what's really going to be the thing that facilitates change. Because at the end of the day, if we all are just still stuck in our own heads of, well, I'm a clinician and I'm a legislator, we're not really going to get anywhere. We all have to find a way to get on the same page and speak each other's language.
Awesome. Thank you so much for sharing. Dr. Amutah-Onukagha, could you respond as well?
Yeah, I think, one of the challenges, so from where I sit, there are 2 challenges. One is just the politics of it all. I get really tired of people missing opportunities, shaping agendas, not being true to the work because of political agendas. Like, I 200% support what Timoria said. When I walk into a room, I'm not here to appease people. I'm here to get the work done, move the mission forward. And so a lot of times, depending on who's at the table and what's at stake and what people's priorities are and what people brought people to the table in the first place, the politics of it really stymies progress. Now that's what just gets me going, because I'm like, it's not about you. It's not about, I don't do the egos. I'm just like, can we just do this work together? And so the politics of it is a challenge. And also funding, right? Like from where I sit, when things are tied to grant funding, what are you gonna do when the grant is over? You have to build sustainable mechanisms in the community for the communities to manage themselves. So that is a recipe for disaster. You're coming in, you're on a very finite clock, you have all these deliverables you got to get done. And then at the end of the project, the community's left with what? So we need sustainable mechanisms that are going to be embedded in the community, right? Like what NeKeshia is doing with the neighborhood birth center, that's for the community, right? Like that's something that I see that's going to be, and I'm on the board, full transparency. I'm on the board of the birth center, but like that's something that's going to be embedded into the community. That's important. It's not about these metrics and white papers and research. It's about how do we create streams of funding and opportunities that are going to give dividends and residual for the community. That's what I think is a huge challenge that needs to be overcome. This whole funding mechanism, the way we're approaching it now, we got the game messed up, because when the hot topic moves off from being maternal mortality, communities are going to be left holding the bag. And so we need to think critically. Yes, we should capitalize on this window. I mean, I just got my study funded by NIH. It's on the radar nationally and federally, but that's not enough, right? And so we need to take these opportunities. to the people that can make it happen, and they need to come to us with sustainable mechanisms as well. So I see that as a reciprocal relationship. But the two challenges are the politics. I don't do egos well. I don't do, subtle agendas well. That doesn't sit with me. And funding streams. How do we make sure these things are sustainable, self-managed for us, by us? Those are the two biggest challenges that I see.
That's awesome. Thank you so much. And Nneka, if you could share as well.
Well, my sisters once again have said everything that I would have said, but I think one of the challenges for me has been not to be that person who is training the next generation all the time, or being always on, trying to train someone, teach someone how to do this work. And also for people to realize when this work is not for them. I think this is a hot topic right now, but everyone in the game does not need to be here. They need to realize that this isn't for them. Their voice is not needed here, that they need to move on to something better or a different level, and to recognize without anyone having to tell them that this is not for them. And also to the newcomers coming in, to remember that we were new once. We waited, we watched, we learned. That's one of my challenges, the newcomers, realizing that a lot of the stuff that they're trying to do now, we were once there trying to break in, but we sat, we walked the streets, we paid homage, we did what we had to do in order to breach whatever thresholds we needed to breach. So just coming in and trying to pull the rug from under our feet, or stealing some of the work without crediting the people who's doing it, who has done it for, who you're stealing it from, that's not acceptable. And that's one of my biggest challenges. And as everyone who has known me knows, I have a hard time. My absolute biggest challenge is knowing when to hold my tongue. If I need to say it, I just say it. And I don't apologize. There's no need. But like I said before, my sisters have said everything. So let's save the time.
Thank you so much, Nneka. And I think, sort of speaking from your experiences, I don't think you have a reason to apologize. So I just want to acknowledge your words and just say that, it's not necessarily a challenge to speak your mind. So I just want to thank you all for your responses, and just thank you for sharing your stories and providing your thoughts about partnering for advocacy work. Now I'm going to turn it over to my colleague Rose to moderate the Q&A portion of our program. So thank you all again, and thank you, Rose.
Thank you, NeKeshia, and thank you, amazing sisterhood. There are just so many thoughts and inspirational feelings that are bubbling from listening to you speak. This comes from one of our attendees, and I'm actually combining two questions together here. The question is that you spoke so eloquently about authentic community engagement. You said, they need to see your face in the place to build trust. And you spoke so eloquently about how there is no shortcut to building relationships, just as there's no shortcut to making great pancakes and doing research. So given that a lot of this depends on the physicality of being in spaces and places with people, how has the double pandemic of COVID and explicit racism impacted your work?
Yeah, that is a great question. It definitely is a double pandemic. So two things. In one way, it has definitely furthered my work. Like I get to do way more talks than, because everything's on Zoom. I'm in my house, like my baby's right outside the door, I can check on him. So because, you know, prior to that, I was very judicious. You know, I have a young child, it's my first child. I'm like, I can only be away from home for one night. I got to fly in first thing and leave first thing. Now I'm on Zoom. He can pop in here at any time. So in one way, it has furthered my reach, and I feel like I'm doing a lot more talks. And so, but in other ways, it's hindered it because you don't get the in-person connection. So I think as someone who has existing relationships in the community, I have not felt that buffering as much, but if I was trying to get into the community, I could see that being a problem. And so for people who are trying to begin this type of work, I think you just have to really understand that everyone's capacity is different and limited right now, and just respect that, be sensitive to the fact that people are homeschooling and people might be out of work, people might have COVID or family members with COVID. Like the world is different, and so it requires a special sensitivity and a patience, right? And so you can't do research on these traditional timelines. All my studies have been either suspended, delayed, and that's okay, right? Because I mean, COVID is affecting the whole world. So I think there's a sensitivity to it, but you also have to capitalize on opportunities. If there's somebody that you want to meet, you know, you send them an email, you are relentless, right? You give them time to respond, but you also have to understand that people may not have that capacity right now, and that's okay. And so I think for existing relationships, it hasn't been as much of a problem. In fact, it's probably deepened my commitment because I can do way more things that I would have done now before. But I think if you're trying to break into communities, it's going to be a bit of a longer road that needs to be approached with sensitivity.
And Timoria, do you have thoughts that you'd like to add to that, please?
Yeah, because, you know, Dr. Ndidi really struck on something I was thinking just about in terms of advocacy. So I was able to really keep my family before COVID very detached from my real life work as an advocate. And so I have a 10-year-old and 6-year-old, 2 girls. And so now they really see so much of what I'm doing. And so they're so curious about what is an advocate. And they laugh. They're like, it looks like you work really hard, but we don't see a lot of money, you know, so they think, I'm like, well, that's pretty much it, you know, so we laugh about that, you know. But, you know, what I want to stress is because it's COVID and there is so much more hardships on people right now, is really think about what being an advocate means to you as an individual. So for some people, that does mean holding individuals and institutions accountable. You know, where do you begin with that? You know, you can write to the head of a department, you can write to the CEO of a professional membership org, or, you know, report something to a professional organization. Some people decide to reach out to legislators for help. Maybe they want to help collaborate on policies that they feel are needed in their community. Others choose to reach out to the media to draw attention to the issues that they're concerned about. They want to create public awareness. But I think it's so important to stress to people that please don't feel like you have to take on a very public role in advocacy to make a difference for yourself or for your community. You know, for example, you could, you know, you have a friend that just had a baby, checking in on that person. That's advocacy, because you're advocating for her self-care. And that's something that a lot of new parents, they have no idea how to fit that into their day. Even just 5 minutes of just someone sending you a couple texts back and forth, it really helps so much. So that's something small. You know, every person has to decide how to advocate in a way that fits their family life, their schedules, their emotional well-being, and also in particular to what they're passionate about. But the biggest question that you have to ask yourself is, how far are you willing to go? You really have to pay attention to that. That's the most important question. How far are you willing to go with the type of advocacy you need to do to create change?
Thank you, Timoria. Nneka, any thoughts?
Well, advocates raise advocates. My children are quite older than Timoria's and Ndidi's. My oldest is 20 and he's a part-time, well, now because of the pandemic, a full-time EMT and a full-time biology major. So that's, you know, plus I have a 10th grader at BLA and my 6-year-old just started kindergarten. So they're very involved in my work. I have several, they advocate for me, they work with me. If I can't do something, they handle it for me, my older two. My youngest is an author. That's her way of advocating. So I really think, just like my sister said, especially figuring out how you want to appear, how much you can take on, how visible you want to be. That's a great point. I haven't missed a beat since COVID started because of the number of hats that I'm juggling. I need some downtime. So December is my downtime. I have a summit in December and then I'm done for the month. But definitely looking at what advocacy looks like to you. How will you advocate for whatever the cause is, whatever cause you choose to advocate for? How does that feel, and how much capacity while homeschooling your children and taking care of elders in the home? We have one of those at our home too, a 94-year-old. So how can you work that into your advocacy?
That's terrific. And all of your comments sort of ping on the next question that I wanted to ask you, which is sometimes it's difficult to operationalize what advocacy in action looks like in everyday practice. And you've said some really incredible things, that you can go small and scale up, that it's really important to ask that question of what is possible. And if the large scale advocacy work is not possible, given what you've said around scheduling family life, emotional well-being, what can you do on a more granular level? What advice do you have for participants in answering that question? How far are you willing to go, and what does advocacy in action look like in practice? I'm going to start with you, Nneka. I'm going to go in reverse order, if you don't mind.
Wow. Well, considering that Timoria and I are both commissioners, and that Ndidi is as public as she is, we've spanned the gambit. But it doesn't have to be that much. You can take a meal to a senior neighbor, and that's advocating. You don't have to. It depends on what, like we said before, what your capacity is. I really don't have anything else to say on that one.
Okay, thank you, Nneka.
No.
Please. Is Timoria still with us?
So for me, when you question how far are you willing to go, that it depends on the circumstance, but it always goes back to, again, centering the patient, right? So again, that means whenever I'm given the opportunity, whatever platform I have, in that moment, I need to say and do everything possible. I need to take not only my own story, but all the stories of all the women and families that I have not only dealt with personally over the last decade, but also that I've read about. And I have to bring all of them with me into that space. And in that moment, I need to make whatever group is in that room understand how much of a crisis we are in. And I also need to give them the tools that I've heard from talking to multiple stakeholders to solve it. So for me, it's about not ever being afraid to say the things that need to be said and doing the things that need to be done. Because as we've seen through history, and we're in another historical moment where we're being called upon to really stand up, not only for ourselves, but for each other. We have to be explicit in our language about what our intentions are. If we truly want change, we can no longer dance around these issues. And, it's not a matter of not being polite or being, all these different things, because it's a matter of telling the truth about the human experience. And in this case, the Black maternal health experience.
Thank you so much. And with 4 minutes left to go in this Q&A piece, Dr. Ndidi, could you share your reflections on that question, but also answer, when you talk about politics, could you define what that means and how it hinders progress? Not a small question.
Yeah, it's not a small question. What I mean by that is just, I think people are getting behind this national conversation around maternal mortality and morbidity for a variety of reasons, some of them self-serving. And the three of us here today, this is our lives, right? And so I don't think that that is the case for this group, but I'm sensitive, protective, territorial around this issue for people that are kind of jumping on the bandwagon. And when I say politics, I mean, like Nneka and Timoria have already said, when you're doing the work of moving this collective mission forward, you don't really have time to speak to egos, or you're not interested in speaking to egos. But if egos are going to be in the way of the progress, that's a barrier, right? And so
Yeah.
people jumping on this bandwagon to move it forward and to kind of ride the coattails off the pain and birth trauma of Black women, yeah, I'm not here for that. And so when I say politics, I mean, you know, being one of very few faculty or one of a few researchers that in this place, I see the work from financial piece to political piece. Oh, how are we going to position this? How is it going to look if we do this? How is it going to look if we say it like that? None of that, like, that's secondary. What's primary is this going to help women? Are we going to be able to address racism in a clinical encounter? Are we going to be able to put resources into the community's hands? So the politics of it is the meandering, the back of the house deals, the offline conversations that can really be a hindrance to the work. That's the one that I just have to call out and be like, you know what, this has nothing to do with the work, and it really has nothing to do with the women. It's about your political agenda, whether you realize it or not. So.
Thank you so much. Thank you to all three of you for the power and the passion and everything that you have shared with us. It's been incredible. I think we're now getting ready to continue the conversation in our breakout sessions, and we'll be giving instructions and links to join those groups shortly. Thank you all very, very much.